Welcome to the Alzheimer's Association Houston and Southeast Texas Recent to Hope event. My name is Roy Cordes, Chairman of the Chapter's Board of Directors. Today, by logging on, you're part of a movement to fight back against a fatal progressive brain disease that is stealing too many of our loved ones. 1 in 3 seniors dies of Alzheimer's or another dementia. But it is not just seniors. 50-year-olds are diagnosed with dementia, like my wife Helen was. We need your help to combat this growing surge. Right here in Southeast Texas, tens of thousands of families rely on the Alzheimer's Association for care and support. We are here today because you are the reasons to hope. Your generous donations, your dedication to volunteer, and your passion to engage our community moves the cause forward. I'd like to take this time to thank our generous challenge donor, Don Baird. You will hear more from Don later in our program. During this 30-minute hope-inspired event, we will be making asks and sharing opportunities of how we can work together to make a difference and put an end to Alzheimer's disease. But first, let's start with the facts and the alarming statistics of Alzheimer's disease and dementia.
Hi, my name is Don Baird. I'm the Alzheimer's Association Houston Southeast Texas Chapter Immediate Past Chair, and I'd like to thank you for spending the time with us today and challenge you to join me in helping support all the marvelous things that the association does. If you are planning on donating $250 this year, please consider upping it to $500. Let me share a few facts and figures about Alzheimer's disease to illustrate why your donation is more important than ever. You know, there are more than 6 million Americans living with Alzheimer's disease. Over 11 million Americans provide unpaid care for those living with the disease and other dementias. 1 in 3 seniors dies of Alzheimer's disease or other dementia. Alzheimer's kills more than breast cancer and prostate cancer combined. And during COVID-19 pandemic, deaths from Alzheimer's and dementia increased by 16%. The Alzheimer's Association is working tirelessly to change those facts. As the world's largest nonprofit funder of Alzheimer's and dementia research, the Alzheimer's Association is committed to accelerating the global effort to eliminate Alzheimer's and other dementia. Not only are we advocating for funding from the federal government and conveying research globally to promote collaboration and innovation, we are also funding research through our research grant program. In 2021, the Alzheimer's Association has over 230 million active research grants globally. Our Alzheimer's Association mission is to seed, speed, and scale research. We seed new ideas by creating and launching studies that otherwise couldn't or wouldn't be funded. We speed the development of new techniques and therapies, potentially saving millions of lives. And we scale research, making science bigger, better, and faster. Locally, in Houston and Southeast Texas area, the Alzheimer's Association currently has more than $5 million in active research projects at Texas A&M University, Baylor College of Medicine, UT Health Houston, UTMB in Galveston, University of Houston, and the Methodist Hospital Research Institute. In addition to those grants, Houston area institutions are involved in several Alzheimer's Association national research initiatives, among them an Alzheimer's prevention trial known as US Pointer, with partners at Baylor College of Medicine and Kelsey Research Foundation, and the new IDEAS study with partners at UT Health, Methodist, and Baylor to demonstrate the value of brain PET scans in diagnosing Alzheimer's in diverse individuals. Another hidden gem in Houston's Alzheimer research field is the Neurodegeneration Consortium, housed at MD Anderson. The Neurodegeneration Consortium is a collaboration among MD Anderson, Baylor College of Medicine, and the Massachusetts Institute of Technology, and the Whitehead Institute. The NDC, as it is known, is headed by Jim Ray, PhD, a neuroscientist with extensive drug discovery experience, allowing him to understand the therapeutic potential of basic science discoveries regarding brain health. He has worked across the spectrum of therapeutic discovery, from academic research to biotech to large pharma, specializing in Alzheimer's disease. He's now interested in understanding the nexus between aging, cancer, and neurodegeneration, and finding therapies that promote the resilience and healthy aging of the brain. In his typical understated way, Dr. Ray says of their work, "We're looking for ways to prevent brain disease like Alzheimer's because there's no cure. By combining the expertise of MD Anderson with the leaders in neurology at MIT, the Whitehead Institute, and Baylor, we're hoping to find some treatments." I'm delighted to welcome Dr. Ray, also a fellow Alzheimer's Association board member, to speak with us today.
Thank you for the introduction, and it's an honor to speak in support of the Alzheimer's Association and the Reason to Hope. As someone who has been trying to develop new therapies that can slow or even stop Alzheimer's disease, I really like the name Reason to Hope because we haven't had much of that in the last several years. We still don't have any drugs or treatments that can slow the onset of dementia, and you probably all know that it hasn't been from a lack of trying. You probably have seen the headlines, another Alzheimer's clinical trial ends in failure. In fact, since October 2003, we are 0 for 500. That is, 500 clinical trials have been conducted by various governments and pharmaceutical companies with no drug approvals. Yes, it's been nearly 18 years since a new drug was approved for Alzheimer's. Meanwhile, every year, year after year, 500,000 Americans and 10 million people across the globe hear the devastating news that their memory changes aren't normal, but rather are being caused by Alzheimer's disease. So I think we could all use a reason to hope that things are going to change, that we can expect science to uncover the causes of the disease and doctors to find treatments. We want to believe that the goal of the Alzheimer's Association, a world without Alzheimer's, is possible. Well, there are several reasons to be optimistic. One is the funding. Alzheimer's research has been severely underfunded relative to other major diseases, such as diabetes, cancer, and heart disease. The Alzheimer's Association, supported by thousands of supporters in all 50 states, has changed the situation dramatically. Federal funding for Alzheimer's research has increased from around $600 million in 2015 to an incredible $3.1 billion per year today. An additional investment of nearly $50 million from the Alzheimer's Association in research, along with funding from state agencies and philanthropic foundations such as the Gates Foundation, means that scientists are now able to explore more questions and generate more answers than ever before. And the private sector is stepping up too. 3 companies in the Bay Area focused on Alzheimer's disease and related disorders have a combined market cap of $10 billion, for example. And large pharma companies like Lilly and Biogen are spending billions on late-stage clinical trials. This team effort has dramatically changed the landscape in the last decade. We have tackled some of the key obstacles to providing successful therapies to those suffering from dementia. One, it used to be the case that Alzheimer's disease could only be diagnosed at autopsy. Since Alzheimer's is the leading but not only cause of memory problems in the elderly, clinical trials had up to 30% of their volunteers misdiagnosed, meaning they didn't actually have the disease. I think we all agree that it's hard enough to cure Alzheimer's disease without having 30% of the people in your clinical trials not actually having AD. But now, thanks to advances in biomarker technology, we can definitively diagnose AD and exclude other causes of dementia in life. We can also use this technology to stage the disease. Previously, we monitored progression of AD by asking questions like, what city are you in? And can you spell the word world backwards? It's easy to imagine that patients could have a good day and nail these questions on one day, then have a rough night and miss them all the very next day. Plus, people who had high educational status and mentally demanding jobs would ace these tests even very late in the disease process, whereas someone with a low educational status might flunk the test even with minimal underlying disease. But now, we stage Alzheimer's disease by measuring the plaques and the tangles in the brain, either directly by PET imaging or indirectly by taking spinal taps. So the effectiveness of a new therapy can be measured objectively, not with these subjective memory tests. The importance of this advance cannot be overstated. We now understand, because of these breakthroughs, that Alzheimer's is a 25-year or longer disease process, and only the last few years are marked by dementia. Now it is possible to screen for people at risk for dementia and enroll them in clinical trials before they develop their first memory problems. This was impossible only a few years ago, and the benefits are being seen already. In the last few years, Biogen's drug aducanumab demonstrated statistically significant slowing of dementia in one of its 2 phase 3 trials. The data weren't overwhelming, it isn't a cure, but only a few years ago, other drugs of the same class all failed. All the patients on the trial were definitively diagnosed with early stages of Alzheimer's disease and were studied independently based on genetic risk factors. The drug cleared the plaques from the brain nearly completely. In science, replication is everything, and within the last year, Lilly announced that a second drug in this class cleared plaques and slowed cognitive decline. Like I said, these aren't cures, but there's potentially historic news here, and it gives us a reason to hope. And better news is coming. A company in St. Louis called C2N is now selling a kit to measure amyloid proteins in the blood, as they believe they can detect warning signs of plaques in the brain by doing a simple blood test. Imagine the possibilities that having a blood test creates. Everyone could be screened for early signs of AD years before any symptoms, just like we do with cholesterol for heart disease and blood sugar for diabetes. Early detection, of course, will be important, but only if there are things we can do to slow the onset of dementia. The good news is this seems increasingly possible. In fact, the incidence of AD has declined 16% in the last 2 decades. The number of people with AD has gone up because the population is aging and people are living longer. But when you adjust for that, the rate has actually gone down. That means better management of risk factors like blood pressure, cholesterol, and diabetes can reduce the chances of getting Alzheimer's disease. The search for more specific and impactful interventions is ongoing. And in fact, here in Houston, people are being recruited to the U.S. Pointer Study, a landmark global effort to figure out if aggressively eating right, exercising, and staying mentally active can prevent dementia. And finally, we know more about the disease than we ever did. From 1993 to 2010 or so, there was only one known genetic risk factor for AD. But with advances in human genetic research, fueled by the complete sequencing of the human genome, that number has grown dramatically. Just this year, a landmark study was published involving over 650,000 Alzheimer's patients and 100,000 healthy relatives. As a result of this study, we now have 75 new genes linked to the risk for Alzheimer's disease. Each one of these is a clue to the disease process and an opportunity for a new therapy. Interestingly, the data indicate that the immune system of the brain, controlled by these cells called microglia, is the key to stopping plaques, which was a complete surprise to the field. Is AD actually a disorder of the immune system? We may find out soon, as the first drugs testing that hypothesis are entering phase 2 clinical trials this year. So I hope you see why there's plenty of reason to hope. To those suffering with dementia or caring for someone who does, or worried that what happened to their mom or dad might happen to them, I think it's fair to say hang in there, help is on the way. Thank you very much for your attention.
It wasn't so much when I noticed it as it was Helen noticed it first. She was experiencing challenges in thought processes, remembering things, finding things, but she was noticing, not so much me or our friends. She noticed the routine tasks and thoughts were more challenging. We talked about it. We talked what some of the options are. Helen and I talked, and we decided that it would be best if we started a diagnosis process to decide what the issue was. She went to several doctors, and we wound up at Baylor College of Medicine, their Alzheimer's group, Dr. Duty, and we were stunned when we were told that Helen likely had early onset Alzheimer's. After adjusting to this diagnosis as best we could, we shared it with family and a few close friends. One of our friends knew the executive director of the Houston Alzheimer's Association. That helped us. We reached out to the association and met with the representative of the association based in Fort Bend County. We learned that we were not alone in this process and that resources were available through the Alzheimer's Association to support us and aid us in our understanding of the journey we were starting together. In addition to the written material we received that identified additional resources through the association sponsored several early onset support groups. We attended them and learned more about the disease, including its progression. Most importantly, we met others that were facing the same challenges with the disease. We talked together, caregivers and those with Alzheimer's, and in groups that included only those with Alzheimer's and another group for the caregivers. Our groups shared experiences and we supported each other. We could cry together, we could laugh together, we could tell stories together. This made the journey a little easier for both Helen and I. With Alzheimer's disease, each journey is unique, but all end in the same place. There are no survivors. As Helen did while she was able, I continue to tell our story with the passion and desire to raise community awareness of the resources provided by the Alzheimer's Association and how the journey may be made a little more bearable.
My experience is similar to Roy's. at the start. In 2008, I noticed that Cheryl was having trouble with words and names and things in the environment that she used to be familiar with. That summer, we went on a Baltic cruise, leaving out of Stockholm. And I found her wandering through the hotel, and I asked her, do you know where she is? And she didn't know she was in a hotel, let alone in Sweden. So we got final diagnosis from Baylor College of Medicine, like Roy did, in February of 2009. After the PET scan was completed, Cheryl was 57. Alzheimer's was the furthest thing on my mind. As a result, when the social worker came in and tell us all the resources that were available, and I'm sure she mentioned the Alzheimer's Association, I never heard a word they said. So unlike Roy, we didn't turn to the Alzheimer's Association. We simply muddled through on a day-to-day basis, basically one day at a time. I tried to read some books on the disease, like the 36-hour day, which were more depressing than helpful. And as the disease progressed, we had to get caregivers for 5 days a week. Cheryl was wandering. And that meant that I was still the primary caregiver at night and on the weekends. I first became aware of the Alzheimer's Association when a friend of mine asked me to walk on their walk team with them. And that time I discovered that all the resources that were available that I had been missing. I got involved in a younger onset caregiver support group, which was wonderful help. The association also helped me find a facility when it came time to move Cheryl into memory care. That was in August of 2012. That was the first time I lost her. I lost her the second time when she died in December of 2013. Today I know that early on I missed the opportunity of using the association's resources to help us in our difficult journey. I now spend a great deal of time speaking to any group that will listen, talking about the difficulties of caregiving and helping those that are struggling with that burden. And when I finish the talk, I'll take out my card and I'll say, if anybody knows somebody that's going through this and would benefit from talking to somebody that's been there, have them give me a call. As a result, I've had calls from people all over the U.S. In fact, I talked to somebody from Virginia today. Caregivers everywhere are reaching out for support, and the association helps them do just that. I'm passionate about giving aid to caregivers because I know that that's one of the most difficult and underappreciated jobs somebody can be challenged with. Most caregivers feel very alone, and the Alzheimer's Association can bring much needed hope and help to the people as well as the loved ones with the disease.
What keeps me involved is having seen the disease firsthand, having experienced it. First with my grandmother many years ago who had dementia, and second, and of course most importantly to me, is my wife Helen when she was diagnosed with early onset. And I saw what it did, how it robs you of the things that make you a unique individual, how it robs you of the things that make you you. Helen had a passion to serve and make our community a better place for all. She served on numerous boards, nonprofit boards. She was a school board trustee. She was always involved and cared. After her Alzheimer's diagnosis, she volunteered time with the Alzheimer's Association. And while she spoke about the disease, she concluded her remarks with, "We need to accept the diagnosis, but challenge the process of the disease. As part of the process, we need to be an advocate, cry a little, laugh a lot, accept the support, and continue to love." That was Helen's philosophy that she expressed. I continue to love and be an advocate to lessen the burden of the disease on those with Alzheimer's and their caregivers. My hope and passion, our hope and passion, is to find the first survivor of Alzheimer's. Please help us on this journey. Now we're going to hear from an inspiring woman, Dr. Ricky Sanchez, who is living with early stage, younger onset Alzheimer's. She gives us all a reason to hope and reason to fight for a treatment quickly.
I am fortunate that I get to speak to many people about Alzheimer's, and lots of times I hear, "You don't look like you have dementia." I usually just say, "Thank you." But what does Alzheimer's look like? Well, quite frankly, it changes. Even though it may sound trite, there are good days and not so good days. But for me today, I'm a wife, a mom, a Texas A&M Aggie mom, gig 'em, a Baylor Bear mom, sick 'em Bears, a daughter-in-law, a mentor, a friend, and yes, I'm usually the tall one, a woodworker, and lifelong University of Houston Cougar fan. Go Cougs! A scholar. Heck, I'm even a certified barbecue judge. I had a wonderful and fulfilling 24-year career in healthcare, and I love the beach. The ocean is always renewing. Each wave brings new possibilities. It never stops, and neither will I. I love and loved being all of those things. And yes, I'm also a younger onset Alzheimer's disease patient. But for us, what was yesterday and what is today walk hand in hand, neither canceling the other.
Alzheimer's is the 6th leading cause of death in the United States, and the only one in the top 10, other than accidents, that does not have a cure, cannot be prevented, or even slowed down. As of today, we have no medications to stave off its insidious nature, but we can conquer this. We're closer than we've ever been.
It was in the summer of 2018, and I could sense that my short-term memory and my ability to learn new things at work were not quite the same. As the chief operating officer of a hospital that was recognized as one of the elite hospitals in the nation, I absolutely needed to be on my A game every day.
However, by the fall of 2019, imaging confirmed that my wife had younger onset Alzheimer's disease, a rare form of Alzheimer's that affects adults younger than 65 and comprises only 5% of all Alzheimer's patients.
I was 56 at that time, and my career was over. Suddenly, our future looked very different. Our retirement was not going to be the retirement that we planned for and dreamed of. I'll admit, the diagnosis knocked me down.
It knocked me down too.
But getting knocked down is not defeat. Not getting up is defeat. But I'm up now.
And I'm up with you.
I always thought that after my career in healthcare, I'd like an opportunity to teach my dissertation topic, patient-centered care. I still have that same vision. But now it's bigger than I imagined because I'll get to reach more people. Yes, I'll still get to teach, but I won't be confined to a classroom standing behind a lectern. I'll get to teach patient-centered care not as a research scientist, but from a different perspective, as a patient. So, although I no longer have an executive healthcare position, I now have an executive healthcare mission to fight for as long as I can, and with your help, win this worldwide battle against Alzheimer's disease.
Only research will lead to the first survivor, and that discovery and research can only happen through awareness, advocacy, and action. So let's be strong and unwavering in our collective endeavor to combat this dreadful disease. Your support and your donation to the Alzheimer's Association is tremendously important. Their continued funding of vital research and their ability to have a positive impact on Alzheimer's patients and their families is really up to you.
Medications that could possibly extend the quality of life for Alzheimer's patients, which directly affects their care partners and their loved ones, are potentially just around the corner. So please, join us on this journey.
And join us in this fight.
I don't want to be someone just sitting around with the disease. I get up every day ready to battle because I have reason to hope that breakthroughs are within our reach so that we will have that first white flower, the first Alzheimer's survivor.
Perhaps that first survivor will be your mother or your father.
It could be your brother, your sister, or your best friend.
Or maybe, just maybe, it'll be you.
Hello again. Thank you, Roy, for your leadership and your input, and Jim for your continued research and update on the quest for a cure, and to Dr. Sanchez for your heartfelt testimony. As mentioned, not only am I the past chair, but I've also spent 5 years being a primary caregiver for my wife, Cheryl. Caregiving at its best condition is extremely difficult, but in today's environment, it's even more challenging. It's important to remember that the Alzheimer's Association not only provides aid to those with the disease, but also the family members and caregivers. There are more than 5 million people with Alzheimer's today, and as we add them all up, it's between 11 and 15 million people affected when you add the caregivers. The need for help is greater now than ever before. In the last 18 months, we have witnessed some miraculous research around COVID-19. With nearly unlimited funds, the medical community was able to develop not one, but 3 vaccines for the virus. Compare that to Alzheimer's disease. Alois Alzheimer's identified the disease in 1906. In the last 115 years, we have yet to be successful at developing a truly disease-modifying drug to fight this deadly foe. The update that Dr. Ray gave us is encouraging, but so much more needs to be done until we can greet the first Alzheimer's survivor. That's why we need your support to give them a reason to hope. The time to help is now. I am personally making a significant contribution today. I challenge you to help match that gift by becoming a member of the Alois Society with a gift of $1,000 or more. Ultimately, all gifts, regardless of size, are valued in that they go toward supporting the incredible programs and resources that the association offers, as well as funding research to find a cure. If you know somebody else who needs Alzheimer's information or support, this video stream will continue to be available. So be sure to share the link with your friends and family. Know that we at the Alzheimer's Association are always here for you. On the behalf of the millions of Americans affected by this disease, we deeply appreciate your time, help in raising essential awareness and funds for Alzheimer's care, support, and research. With your help, there is a reason to hope. Thank you.